Okay, now I'm going to show you an alternate way to do myofascial release for the thoracic inlet. I'll show you the diagnosis and then we'll do the treatment. To diagnose for this particular treatment, you're going to look at the rotation of the thoracic inlet. And we're going to do that by bringing our fingers just in the infraclavicular space, just below the clavicles, approximating ribs 1 and 2, somewhere right in here. And you're looking to see which side is deeper. The deeper side is the side to which the thoracic inlet is rotated. So if he was deeper here on the right, if your patient is deeper here on the right as compared to the left, then they're rotated to the right. For the treatment, I want to show you the hand placement because it'll be difficult to see on the patient. You're going to have your fingers just over and or lateral to the spinous processes of T1 to T3, sometimes C7, depends on where it feels most stuck to you. Let's show you what it looks like on Ryan. To diagnose, I'm going to get my fingertips just inferior to the clavicles in that infraclavicular space, and I'm going to look for which side is deeper. And it just so happens that Ryan is deeper here on the right side, which means that this thoracic inlet has rotated off toward the right. You see how that happens? If he rotates off toward the right, this side's going to be deeper, this side's going to be more shallow. So I'm going to start my treatment on the side to which the rotation is happening. So I'm going to start here on the right side. My posterior fingers are going to contact the spinous processes of C7, T1, T2, T3. Whatever in there feels most stuck. Can you pull up toward me? So right here I've got contact with the spinous processes and just laterally. I want to get lateral because I'm going to use those spinous processes as a hook to pull toward me. Go ahead and lay back on your back. My anterior hand is going to be contacting the anterior aspect of the thoracic inlet, just inferior to the clavicles. I can lay my hand flat or I can just use fingers, whatever works best. I'm going to use my whole hand. And you're just going to use that at a little bit of compression to engage the tissues, and then you're going to pull the spinous processes toward you, toward the right, and the anterior tissues toward the left to bring that whole thoracic inlet rotating toward the left. This is a direct myofascial. And as I do that, I'm going to feel right as I get to the barrier, everything starts to tighten up. If I go too far, things get too tight and things won't move. Once I find that perfect barrier, I'm going to ask my patient to take several really large, big chest breaths way up high and breathe out and pick up the slack as he breathes out, and a few more of those. Big breath in. Hold the tension throughout that system that you've created. Breathe out as he breathes out. Follow the barrier, and one more time. And let it out. Still following that barrier all the way through. You can do a little shaky shake if you want. And then once you're done with that, go back and recheck your landmarks, and the rotation has improved.